Hey, what's up, guys? Haven't made a video in a while, so I thought I would make one today, especially since there was an announcement today from Senator Sanders, who released his bill for Medicare for all. Now, I've written about this before in the past, and I would definitely say that I lean left in my political views, and unfortunately, healthcare is tied in with a lot of our politics today. So I don't try to keep the discussion too political. I just try to keep it more to the point of how this is going to affect you, the patients, and the people that are going to be utilizing our healthcare system. I have read over the bill. My initial concern is, one, that there's nothing in there indicating how they're going to finance this thing, and his goals are certainly lofty. I think this is probably definitely more of a starting off point for the negotiations. But the general gist of it is he doesn't want anybody to pay for anything ever. That it should all be covered by the government. Everything. All of your healthcare services should be covered by the government. I don't know how we're going to pay for that. Then my other concern is, if we do go for this Medicare for all, what happens to the United Healthcares, the Blue Cross Blue Shields, the Humanas, the Cignas, the Aetnas, all of those people that work for those companies? Where are they going to go? What are they going to do for work? What impact is this going to have on our economy? Because now we're going to have a bunch of people unemployed. How high will we have to raise our taxes to actually make this thing work? And doing some research and looking at other countries that have attempted to become single payer, that's the biggest issue. They work out these ideas of what they want to do, what they want to cover, but when it comes down to the financing and how they're going to pay for this stuff, that's usually where it falls flat. In Senator Sanders' own state of Vermont, they were looking at single payer health care. Had it all mapped out. Legislators were working together to get it passed, until they crunched the numbers and realized that they're going to have to raise the I think it was the payroll tax or income tax. So one of the taxes, there's a couple taxes that they're going to have to raise by minimum 9%, some of them up to 11%, which is a lot of money, So I definitely, I like the idea, and I definitely want to lower the out-of-pocket expense that patients have to pay, but I just don't think that Medicare for all is the best solution in order to get that done. To this point, I'm not in favor of single-payer health care, just because I don't see the economics. I don't know quite sure how that would work out. But what I do see, what I think that we certainly can change is, if you take a look at our health insurance companies, the big ones, your Blue Cross Blue Shields, your United Healthcares, these companies are making billions of dollars every 3 months. Billions of dollars off of people who are buying their services to help lower their out-of-pocket. Yet medical bills are the number one reason for bankruptcy in our country today. So for me, morally, it just doesn't make a whole lot of sense how these health insurance companies who are providing the service to their customers to cover them for medical costs are still making billions of dollars, and the people are going bankrupt over medical bills. I think that we have a lot of opportunity to get that corrected versus blowing up the entire healthcare system and trying to switch it to single payer. Maybe down the road in the future, that's where we ultimately end up at, is single payer. But my concern is, I think there has to be some responsibility needs to fall on the patient. They need to have some incentives to live a healthy life. Because if we look around, especially in America today, the standard American diet is terrible, and you look at all these diseases that we have, these chronic diseases that we're treating, and a lot of it is due to their poor choices that people are making in regards to their health. And if we open up this gate and say, listen, everybody's going to get health insurance, everything is covered no matter what, you don't have to pay a single dime ever, everything is going to come out from taxes and the government take care of the rest. How is that incentivizing people to be healthier? I mean, we already have a problem today with people paying a ton of money, and people are still not living a healthier lifestyle. So I don't support the Medicare for all. I don't think it'll work. I certainly don't think it's going to pass. I don't think it's the right direction that the Democrats should be going towards at this point in time. It just doesn't feel right for me. That's just me personally speaking. And again, for the people out there, I think on paper it sounds good, but again, you got to look at how is this going to affect all the other industries. How many employees work in health insurance industry right now? How many people work in hospitals, myself included? So I'm a bit biased with this, but I think it's because I'm exposed to this every single day, and I see what kind of impact this would actually have on our nation, and that for me is why I don't think it's going to work out. So just wanted to share that little bit of a rant. I haven't made a video in a while, and I wanted to get that off my chest. I've been thinking about it all day after I had read the bill at work earlier, and like I said, in theory it sounds good. I don't know how we would be able to execute that. I would need more information on how we would execute it before I could support a bill such as Medicare for All. So you guys have a good rest of your day, and I'll talk at you later.